So just a few housekeeping rules to start with. I think everybody's muted on arrival. We're asking people to use the chat facility to introduce yourself. So just pop your name, your organization, and where you're based in there, so we can all just have a bit of an understanding of who's on the call. As we go through the webinar, could you please use the Q&A function to ask questions. It does say place any questions in the chat, but we prefer that you use the Q&A function if possible. And that's questions to any of the panelists or just questions in general. There will be a poll at the end, so we'd be grateful if you could stay for the last minute and fill that in. And just to let you know, the event is being recorded. And we will be using that for our notes and so on. And also that this event is eligible for an HPass badge if you stay for the full event. And there's an email address there to contact Megan if you'd like more info. I think we have a slide on HPass, but some of you will already be aware that we are partnering with HPass as part of an attempt to it's to offer some sort of professional recognition for sort of continuing professional development. And there are a certain number of badges, and you can, once you've attended a webinar, you'll get an email automatically inviting you to take up the badge. And there are different ways of using them, which I'm sure will be explained in the email. So on that note, I'll move on to today's webinar, the content. We're talking today about COVID, of course, keeping up with COVID-19. We've had a number of roundtables, a number of webinars over the last year on this subject, but we felt it was a kind of opportune moment now to revisit it because of some of the new publications that we have just published and a few other issues. So you'll be aware that we've been doing a series called Keeping Up with COVID, Essential Guidance for NGO Security Risk Managers. And in the past few weeks, we have just published 3 new modules, 2 of which you will have seen on our social media and so on, which are gender-based harassment and abuse for risk personnel and abuse risk for personnel, and cost implications and donor requirements. And as of this morning, it's just gone live, the newest one, which is on inclusivity and security risk management. And we'll be doing a bit more social media promotion about those next week. We'll also, in this webinar, be discussing the initial findings of the COVID-19 vaccine benchmarking survey that GISF has been running. So today we're going to be joined by 2 of the authors of the modules and a GISF member who was interviewed for the module on gender-based harassment, and also by our very own Tara, who most of you know, or some of you will know, who has been leading on the vaccine survey. So to introduce the speakers, we have Elizabeth Detweiler, who's an NGO risk management specialist with over 10 years of experience in security risk management, coordination and humanitarian access. We have Nemisha Mascarenhas, who works as a research consultant on gender analysis and social inclusion. And we have Johanna Costa, who is the MENA Safety and Security Advisor for Kvinna till Kvinna, which is a Swedish organization, and also Tara, who I mentioned earlier. And I think all of their bios are being put in the chat, so you can see the detail of who they are and who they work for and their various credentials and experiences and so on. So what we're going to do is, first we're going to start with Tara talking about the vaccine survey, and then we'll move on to Elizabeth and Nemisha, and then followed by Johanna. After each of the sessions, we'll have a very brief questions for clarification only, but then the bulk of the time at the end, we will have on questions and answers for the panelists and a discussion on some of the key issues that have been raised throughout the webinar. So on that note, I'll hand over to Tara to take us through the initial findings.
Good morning, good afternoon, good evening, wherever you may be. Thank you for tuning in today. So as Heather mentioned, we've been working on a COVID vaccine benchmarking, basically to kind of give us a sense of where everyone sits with regards to how the vaccine rollout might impact policy decisions and return to office planning. So the majority of our respondents were, oh, pardon me, is my slides moving ahead? Are they advancing?
Your slides are in, you're in what's it called mode? We can see your whole screen, not your presentation.
Oh, thank you. Okay, thank you. Okay, so the majority of respondents for this preliminary findings were in fact GISF members, but this was actually open to our network of supporters as well. As you can see, majority were in fact GISF members. Also, the majority respondents who did complete this survey were from security. Other represented groups who participated in the findings were from HR, programs, and country offices, which you'll see soon as well. The majority of the roles sit at the global level, so keep that in mind with the responses you'll see coming now. So does your organization have a return to office policy and or guide? The majority have said yes, but there is a considerable amount about who have said that they are still considering their return to office policies or guidance. Has your organization surveyed staff on preferences for return to office strategies? The good news there is sounds like majority have in fact reached out to their staff concerning their return to office preferences. What is the return to office status of your organization's overall portfolio? This was a option where respondents could select more than one and indicate accordingly. The highest ranking was that some offices are partly open, followed by all offices are reopening gradually per jurisdictional regulation, and then staff will have the option to return to in-office working. Some notable additional comments on this particular question were staff will be required to partly return to offices when they are open again and will partly work from home. Another respondent noted that most country offices are open and operational with strict hygiene rules, and HQ remains open, but most staff are encouraged to work from home with limited people who can be in the office. And another noted that most offices are open around the world at certain levels, however, their headquarters is closed. So who are the key decision makers in your organization for return to work plans? Perhaps unsurprisingly, the majority is the C-suite level. But I will note that in addition to security, HR, there were some other mentions of people who are involved in these decision makings, from health advisors to the EMTs to security incident to other SMTs, excuse me, regional and country directors, facilities and logistics, and legal and operations staff. So is your organization developing a policy around COVID-19 vaccines? Majority have said still considering. So this survey, as you may have seen on the first slide, was conducted roughly between March 14th and approximately April 12th is when the data was pulled. So some of these responses may shift over time as we continue to learn more things about the vaccine rollouts. Are you planning to make vaccination a requirement for return to office? Still, a lot of questions around this remain. As you can see, the majority respondents with over 51% suggesting that they are still considering, followed by a strong no of about 41%. Now, if yes, and or still considering on having a vaccine policy, becoming COVID vaccinated is recommended. That's the largest respondents are saying that it will be recommended as opposed to required. Other comments on this that were noted from respondents include that they're following WHO guidance, which does recommend the vaccine, getting a vaccine. And others have noted, depending on the national legislation, in many countries, vaccination is not obligatory. So if you are still considering or having a vaccine policy guidance, are contingencies being considered for staff who are unwilling, hesitant, and or unable to take a COVID-19 vaccine? The majority of respondents say that they are still considering this, nearly 50%, followed by about 30% who say yes, they are considering policies or guidance for staff who are going to be unwilling, hesitant, or unable to take a COVID-19 vaccine. Are you considering vaccination as a requirement for staff travel? The majority here also, I know this is a very key question for a lot of people, and the majority is still considering this. We're nearly 50%, 46% are still considering this, followed by a 30% who have said yes to this. So there's still a bit of a gap in terms of where people are on their planning with vaccines being required for travel. So with that question comes some other key considerations. If the questions were, if you're considering a vaccination as a requirement, how is your organization planning to accommodate government or other jurisdictional regulations, including financially? So respondents answered in almost kind of a split way, where organizations will cover some incurred related costs, which kind of took the top ranking here, and then followed by organizations will cover any incurred costs related to COVID-19. Some of the additional comments here it will depend on consultation with external experts, and it'll depend on if the vaccination is a requirement. So some of the other deciding factors will come into play based off of some of the previous questions that were mentioned. So just to give you a couple of quotes from this question. So we asked respondents, what guidance, if any, are you giving to country offices who may not have access to a COVID-19 vaccine for an extended period? There were several responses to this, but I've just pulled out a couple examples here. So a couple have said they'll carry on with the normal COVID measures such as social distancing. We will look at international staff getting it elsewhere on their travels. We're advising that staff should wait to be vaccinated as per their respective national programs. It depends on many different things, including local legislation and requirement. Risk groups, expats should not travel there. However, alternatives are not clear. It's still under discussion, probably not guidance, but will be folded into an overall SRM or HR policy or considerations. So what, if any, are your concerns about the vaccine rollout? So this will, concerns about the vaccine rollout impacting your organization's operations. So this question also had several different respondents, and I've just pulled a couple here on this page and the next. And you'll notice that majority there's still some questions looming because there's a lot of information still being pulled out from various sources, WHO, local jurisdictions regarding the vaccine. So you'll notice in some of these commentary, you'll see that kind of come clear. So it'll go at different paces in different countries. So there'll be differences in coverage amongst our teams, and not much we can do until it is available on the private market. That is still a question of the timing of that. Travel disruption, security threats elevated for organizations involved in vaccine programs. Staff relying on immunity once vaccinated, and also contacting non-vaccinated beneficiaries, inequities in access, balancing vaccine and our commitment to vaccine equity whilst continuing to be programmatic, internal tensions that some may receive the vaccine and others may not. Staff's health, long COVID, worldwide economic crises is a concern. National laws do not allow or oblige staff to have a vaccination, and European privacy laws do not allow an employer to even ask if employees are vaccinated. Questions about safety from some vaccines which may be available in our countries of operation, but are not certified by reliable EU, UK, or US regulators. Unclarity remains about WHO's certification process and increased risk to organization staff if early access to the vaccine is available. No jab, no access regimes could cause problems with travel, especially inter-program, for example, Africa to Africa, difficult ethical and moral area of early access once on the open market. Organizations are keen to use security as a justification to further restrict travel. So those are some of the main considerations that were explored as part of this initial analysis of where we are with the benchmarking. And I'll just go ahead and leave it there. Again, there were additional respondents, and we'll continue to track this over time as things do change and additional information about vaccine comes out all across the globe. I think we might see some changes in where organizations are seeing their policies, and perhaps we'll also see some changes in organizations that have suggested one approach previously. There may be some adaptations depending on the phase of the rollouts with the governments, but also as things may or may not go the route of commercial.
Thank you very much, Tara. That was a great introduction to this piece of work that we've been doing. And as Tara mentioned, I'm not sure when we're closing the survey, but you can still participate, I think. Yes.
Yes.
And somebody will put that in the chat. If you haven't done so already, obviously the more people that participate, the more kind of useful the data is for everybody. And we will be producing some kind of, not quite sure yet, but some kind of analysis report that will be shared with members on these findings. If there are there any specific questions for clarification before we move on? If you have any that you'd like to ask Tara, you can raise your hand. Although I can't see who's got a, yes, I can. If anybody has a raised hand. If not, then we will move straight on to the next speakers, and you'll have an opportunity at the end, obviously, to ask questions. And it will be interesting to see how the work that Elizabeth and Namisha have done touches on some of these questions that have been raised by the vaccine survey, particularly about sort of inequities between different kinds of staff and between different country programs and so on. So on that note, I'm going to hand over to Elizabeth and Namisha. I'm not sure who's speaking first.
I'll be speaking first. So thank you so much, Heather, Tara, Lisa, everyone at GISF for this incredible opportunity to contribute to the modules building off of the wellness and recovery document from last year. This has just been a great journey for me, and also I think, Namisha, you'll share that sentiment as well. Having the opportunity to talk to practitioners, having the opportunity to talk to a number of experts in these different fields, and bringing these findings together, with these experiences together to come up with some really practical guidance. So let me just go ahead and share my screen. Okay, so Heather, can you just verify for me that that's visible?
Yeah, that's perfect. Yeah.
Okay, super. So I'm going to be starting off just by looking at the module that we did on inclusivity, and then I'm going to hand it over to Namisha to look at the gender-based risks. So starting off, of course, the topic of inclusivity, as you may be well aware from the last year, there have been a number of pushes for larger larger focuses on diversity, equity, inclusion in your own organizations, as well as in different companies, different sectors throughout the globe. I hope that you are engaged in those initiatives within your organization. Really, these are issues that need to be addressed systemically, but this particular module also wants to give you some quick tips or well-founded tips on how to do that as an individual. So as someone who holds power and privilege as a security risk manager, maybe at the global level or at the regional level or even at the country level, we can do things as individuals to push this agenda forward. So we'll start off by just looking at some of the definitions that we use. We talk about, first of all, intersectional risk profile. Someone's intersectional risk profile, we're taking this term intersectionality, which originated from a US law professor in 1989, to talk about how different facets of a person's personality, or sorry, a person's characteristics or traits really impacts how they may be subject to discrimination in different forms. So we've taken that term intersectional and we've applied it to someone's individual risk profile. So looking at how all of these different facets of you as a person or as your staff, as people, affect how you are more vulnerable or less vulnerable, how you may have different coping mechanisms for different risks. And of course, inclusivity. So if you can think about intersectionality as all of this information that feeds into someone's risk profile, what we want to see as an inclusive security risk management practice is taking that information and applying it to your decision making. So making sure that no one is unfairly treated or disproportionately favored in your risk management practices for any other reason except that they are experiencing a higher or lower degree of risk. So looking at how resources are allocated, not necessarily by default, and I think this is something that really happens commonly in our sector. We look at internationally hired staff and nationally hired staff and looking at how the resources are allocated for their risk management. This is something that is not inclusive. So an inclusive practice would be looking at how we, to take a term from the humanitarian sector, impartially designate our risk management policies and procedures and impartially allocate resources to reduce risk for personnel. So why is it important that we look at inclusivity during COVID-19? Well, the virus and the pandemic has really highlighted or exacerbated inequalities that have been pre-existing, but also brought up new ones. So if you look at the different levels of risk facing our global community, there is inequality or disproportionate, for example, physical health risks that are affecting people in different ways, or ways that people have been affected by the socioeconomic impact of work from home orders and social distancing. This not only falls along lines of age and pre-existing health conditions, but also frequently has been falling along lines of race, gender, ethnicity, and geography as well. So these are differences that we've noted in our paper, and also we've included an annex that gives you some detailed resources that you can refer to when you want to interrogate this further. So we also think it's important to look at inclusivity in particular because there are unique parameters for decision making as security risk managers at this time. We find that it is global, it is personal, and it is uniquely unequal. So it's global in the sense that managers have to make broad-reaching decisions that impact multiple locations. And in this context, we often deprioritize or just simply are not able to take those consultative steps that we may have otherwise have taken. So we have to take an extra step, an extra measure to make sure that we are being as inclusive as possible, even though we have a lot of work to do and a lot of people to take care of and a lot of decisions to be made rapidly. It's also extremely personal. And again, this is a very unique parameter in COVID-19 is that we're not only advising different country offices, we're not only advising different staff about this risk, but we are also thinking about ourselves. So we're thinking about our family, our friends, our colleagues in the offices that we are working in or are used to being present in. And that means our ideas about the pandemic and our perceptions of risk are very influenced by our immediate environment and the information that we're exposed to on a daily basis. So we have to take that extra step to overcome that initial bias. And also we have to advise and support teams who may be affected disproportionately. This is the unequal part, right? So we may not be impacted in the way that somebody else is impacted by these particular risks. And we have to take that extra step to understand that better and look at firsthand information. So some good practices, again, these things need to be addressed at a systemic level, but these are good practices that you can take as an individual security risk manager. So first of all, we advise, examine your own power, privilege, and biases when you're making a decision. These definitions are also included in the paper, and you can read about them further. But some ways you can think about this we're prompting people to ask, or risk managers to ask themselves these questions as they are making a decision. So first of all, what power, privilege, and biases do I hold? Looking at that, who has been included or excluded in making this decision? So who's in the room with me, or who's on this email chain, or who is being consulted when we're making a decision? Do they all happen to be people who are sitting in the Capitol? Do they all happen to be people who are sitting in the global north? Do they all happen to be white? Do they all happen to have a certain socioeconomic status? If that's the case, then something is missing. So we need to look at who's being included and also who's being excluded. Again, who does this decision prioritize? I mentioned the disparity between nationally hired staff and internationally hired staff that comes up time and again, but this also may play out in different ways when it comes to gender, when it comes to ability. So are we giving unequal attention or unequal priority to certain groups in our decision? Also, is this decision informed by direct firsthand information? And I've included a couple of examples in the paper that sort of highlight what would be a decision that's made based on metadata, based on secondhand information, based on what we may consider to be, objective resources or objective sources of information, but may be misleading because it's not really reflecting the reality on the ground. So it's also important to look at firsthand information. Another way we can practically be inclusive is to make sure that our security risk assessments are inclusive. And as SRAs really form the basis of good risk management decisions, including decisions about resource allocation and planning, it's really important that these processes are inclusive. And every good security advisor I know ensures that their SRA is inclusive, but these processes that we've invested in or built up may not be possible under the current conditions of COVID-19. So it's not always possible to get people in the room. It's not always practical to travel to a site to conduct an SRA. So we give you some tips on how to do this, including under the circumstances of social distancing as well. We also talk about designing inclusive policies and plans for COVID-related risks, and give you some tips on how to do that. And just really fundamentally asking yourselves, are the recommendations that we're giving practical given the unique profiles, abilities, and needs of the person involved? And again, in the paper, we have a kind of list of recommendations on how you can make sure that these policies and plans are inclusive. We also talk about making the work environment a safe space on and offline. Now, some people may look at the issue of safe space or sort of making spaces free of harassment, free of verbal abuse, emotional abuse as more of an HR issue. But I would argue that security often frequently overlaps with HR. This is not exclusively an HR issue. And as you may be well aware, oftentimes internal threats that are affecting personnel, affecting them personally, emotionally, or affecting their productivity can often be just as detrimental or even more so than external threats that we're more used to looking at. So making sure that the working environment for personnel is safe from abuse and harm, things like microaggressions and discrimination is also a security issue. And we give you some tips on how to do that in your practice during COVID-19. Finally, we talk about actively recruiting, retaining, and promoting diverse security staff. As a security, in security risk management in particular, diversity is key to building trust among staff, expanding your network, and demonstrating by example how to create a safe space for everyone. So again, I really hope that you do enjoy this paper. It just came out. I'm very excited to get your feedback. And now I'll hand over to Nimisha to talk about gender. You're on mute.
Sorry, I realized I was muted. Thank you so much. It's such a privilege to speak with you today about these modules. Now, there are many points we want to consider when looking at gender-based harassment and abuse risks that are important to consider during this COVID-19 pandemic. Now, with the stress of isolation, exacerbated social and economic situations, and continuous work pressure, we've seen a substantial increase of incidents during COVID, impacting staff health, well-being, and professional performance. So normally in the physical workspace, harassment might be more easily recognized. However, when working from home, it can be a lot more difficult to identify. Now, many staff do not actually report sexual harassment or domestic abuse out of concerns that the report will not be dealt with seriously or confidentially. And as a result, they fear personal or physical retaliation. So because of this, the numbers are largely underreported. So it's important to understand that we're dealing with a much bigger issue than the statistics are actually reflecting. As a rule of thumb, the estimate of prevalence of cases within a given population should be considered indicative of the level of prevalence among staff. Normally, when an incident occurs, employees are able to turn to HR, as Elizabeth was mentioning. However, because of downsizing and cuts have been made to protective departments like these, survivors are actually more isolated than before from help they previously were connected to. Now, working from home and being physically apart from other employees, staff are still being exposed to harassment in the digital space. With cyber harassment at an all-time high during COVID, especially through employer-provided technologies such as phones and computers, these forms of harassment can take the form of inappropriate content, such as photos and videos being shared, Zoom bombing, and sex trolling. In some environments, private security companies have actually been made effective gatekeepers with significant power over movement to enforce lockdowns and other measures during COVID. So we've seen cases where female staff who have needed to move outside the home. There have been an increase of risk of these officers asking for sexual favors in exchange for freedom to move around and access to scarce resources. Now, during COVID, there are many things that we can do for good practice to prevent gender-based harassment and abuse happening to personnel. The first is being aware of the increased frequency and evolving modes of sexual abuse and harassment, especially online. We need to be taking proactive steps to prevent this from happening. And a big part of that is not being dismissive of this type of behavior when it's brought to your attention, as that can really create a culture of tolerance we want to avoid. Now, training your staff on how to reduce risk is incredibly important to raise awareness and prepare personnel on how to respond to this behavior. So an example is providing comprehensive workshops on how to respond to sexual harassment and domestic violence. These workshops could include information on signs to look for, sensitivity training, language to adopt, and how to centralize care around the affected person, including post-incident follow-up processes. Now, it's important to understand that all locations are different, and so guidance should really be localized and updated based on local laws, medical assistance, legal support, advice on information for local shelters and medical contacts. Now, staffing can be a huge asset in reporting procedures. In more conservative climates, having female security officers can really help personnel feel more comfortable filing incidents or seeking help and support. Now, mental health is something that hasn't been given enough attention, but it is becoming increasingly recognized as a crucial element for staff health and well-being. Additional stress and decreased access to basic necessities have had a very heavy burden on mental health, and it should be considered a priority when dealing with prevention and post-follow-up incidents. Now, when supporting staff who are survivors of domestic abuse, it's imperative that we take a victim-centered approach that empowers survivors with dignity, tools, and resources that they can use to improve their situation even through the pandemic. Now we have a very detailed list with many more examples, so I really encourage you to read through the documents to have a better picture as we move forward. And I'll pass it back to Elizabeth for our wrap up.
Sure, thanks, Amisha. So I have this quote on the screen that I would like everyone to consider and just really take a moment to think about, and maybe type in the chat if you agree with this or disagree with this and why. So good security risk management practices are inherently inclusive, and the two are indivisible. So think about that and then write in the chat if you agree with it, if you disagree with it, and why. Thank you. And now I'll hand it back over, I think, to Heather, and then we can.
I'm sorry, I was on mute. Just seeing if people are starting to put some answers into whether they agree or not. Personally, I put that I agree it should be, but I'm not always sure that it is. It's you know, it's absolutely common sense that it should be. We're getting a few more people saying they agree. I mean, yeah, everyone's agreeing. It'd be interesting to if anyone has any kind of thoughts on you know, whether it is in practice in your location or your organization or whatever. But we can think about that as we go through. And now, if there are any, oh, I should say, sorry, are there any questions for clarification on either of the speakers' presentations, Elizabeth or Lamisha? If there are, you can just raise a hand. Otherwise, if you're starting to think of you know, more complex questions or any questions, please do start to put them in the Q&A, because we will be coming to that shortly. I'm just having a look back. Oh yeah, getting a few more things into the chat, but we can come back to those after Johanna's presentation. So Johanna from Covinna till Covinna is going to talk to us about some of the sort of more practical ways that these things have impacted on her work in MENA. Thank you.
Thank you, Heather, and thank you so much for the GISF team, and also to Elizabeth and Amisha to inviting me to be part of this discussion. Gender and inclusivity are definitely key points in how we perceive security risk management, and I hope I can provide a good input to the participants. So let me just share my presentation with you. Yeah, okay, 1 second. Okay, thank you so much for inviting me. As I mentioned before, my name is Joana Costa, and I'm Covinna till Covinna Safety and Security Advisor. Covinna till Covinna, it's a women's rights organization with the mandate of promoting women's rights in over 20 conflict-affected countries around the world. In MENA, we do so by supporting more than 30 local partner organizations. And today, I'm going to be talking about what does gender-based harassment and abuse risks for personnel during COVID-19 means to women's rights organizations in the MENA region. I just want to put this presentation on. Sorry, just 1 second. I'm having a bit of a technical difficulty here. Yeah. Now it's better. Okay, so as you can see on the top of this screen, we have this orange ball that basically exemplifies what are the characteristics of the operational environment of women rights organizations in the MENA region. So as we all know, the coronavirus pandemic has been hitting women especially hard, in particular in countries with protracted conflicts, widespread poverty, poor healthcare systems, and non-existent social protection. Meanwhile, closed borders and curfew restrictions and curfews restrict the work of women's rights in the region. When it comes to safety and security, women's rights defenders, they face the magnified effects of COVID-19 on the already pre-existing operational context. So we can see that normally in the work of women's rights organization, aside of many contextual risks that we all share, we also share increased digital surveillance. We also face the shrinking space, patriarchal power structures, and also unequal access to justice. So one of the big impacts of COVID-19 on women's rights organizations were not new to us, but they were magnified by this layer by these risks and these threats to women's rights defenders and women's rights organizations. So one of the risks that we observed in the MENA region was, for instance, exposure to COVID-19 and the lack of adequate PPPs during the first month of the pandemic, super exposed staff in women's rights organizations to the risk of contracting COVID. And also that affected the type of treatment that they could get in countries around the region, and also increased levels of stress and anxiety. Also, the increased secularization of the state with emergency laws that prevented women from using the civic space to raise awareness for women's rights was a big concern to women's rights organizations. So that space was blocked. And at the same time, the lack of movements due to curfews and lockdowns provided an opportunity for harassment by unprofessional elements of security forces in checkpoints. This was of high concern for us. Even NGOs that were able to move and provide services, they faced the increased harassment and threats from security forces. Mostly of women's rights organizations, they are most of the time, and the majority of the staff are women. So that also made them more vulnerable to this type of harassment from mostly male security forces. Also, the increased operational risks in areas of protected conflicts. This was very interesting because working on the community level, when it comes to women's rights organizations, these organizations, they rely a lot on the community presence, being community meetings or community representatives or leaders. With the closure of movement and the restrictions on movements, it made that this access to community leaders that are essential to mediate acceptance in the communities became very restricted and vulnerable. And that triggered higher concerns and also opened the space and the exposure for harassment of women's rights organizations, mostly from non-state armed groups. This is very important because normally non-state armed groups in the Middle East, they have worldviews that contrast from the worldviews from women's rights organizations. So this type of risk was of high concern for us, as some of these organizations could be directly threatened by these individuals without this mediation layer from the community. Passing on to the digital harassment and surveillance, there was an increase also in a way how women's rights organizations, they felt and the risks of harassment. So with the migration from the physical space to the digital space, women's rights organizations had to rethink about what safe spaces were. So there were some actions on the internet, such as community shaming and exposure of low-profile women's rights defenders in their communities that were also verified and observed. The logic here is the same logic as before. Sometimes these communities, they have elements they share contrasting worldviews from the values that women rights organizations defend. And this was a great opportunity also for shaming online and exposure women rights organization staff and women rights defenders. And that increased not only the risks, physical risks, but also anxiety and stress on these women. And also in areas where the state has a strong surveillance of civil society organizations or groups, there was a need to look at the online safe spaces alternatives. So if before these women's rights organizations, they could use tools that are on social media, for instance, to meet, that was no longer possible. And women's rights organizations, they started looking for more tailored development alternatives to be able to create that space online that has a higher level of firewalls, and they were less likely to be identified by surveillance. Also, and lastly, there's an increased likelihood of domestic violence. So this is a global trend. And we understand that with prolonged lockdowns and curfews, there was a registered likelihood for increase of physical and psychological domestic violence affecting women in the region. So having these risks in mind, from a Kivina to Kivina risk management support, we adjusted our support on 2 levels, and we mainstreamed it on 2 different levels, one on staff and the other support to partner organizations. Of course, that this type of support has different, in terms of duty of care, has different understanding in terms of scope of support that we provide. For staff, for example, psychological support was on the top of the agenda. We understand that women that go under confinement, they have to juggle and balance between work life and personal life. That can generate high levels of anxiety. So since the beginning in our organization, we thought that we should think about and support staff on a psychological well-being from a personal and particular circumstances point of view. So HR was the lead in this case, and security and finance, they supported HR in reaching out to staff and offer these services if necessary. Also, there was an increased investment in safety and security awareness through routine check-ins, COVID-19 C-traps, and encouraging on incident reporting. This was very important for all of us because the distance made that personal contact that we normally have with staff was lost. And having, so there was an increased effort in checking in on the well-being on each one of us and trying to understand if there are any other risks that have been noticed and how to support with mitigation measures on a one-on-one level or even on a program level. In terms of incident reporting, this was particularly important when it comes to sexual harassment and abuse. In this case, our conversations, they always highlight the fact that any type of reporting is deemed confidential for sexual harassment and abuse, and we encourage staff to report. And we have systems that allow staff to report on confidential incidents if they need to, and of course receiving the corresponding support from the Safety and Security Department. Also, in terms of COVID-19 direct and indirect risks, we all updated our business continuity plans, and we promoted security risk assessments that are adjusted to the context and to COVID-19. The same was conducted on country level security plans and for domestic travel security procedures. Regarding our partner organizations, we had also psychosocial support and well-being at the core of our support. So in terms of safety and security awareness through routine check-ins, we made sure that we pass on that message. Also, we promote partners to update their business continuity plans through our yearly safety and security orientation sessions. These are more deep into safety and security structures and best practices. So we go through principles, policies, and procedures. And lastly, as mentioned before, we have an integrated approach to security and well-being. So we consider these two components, security and well-being, as part of the same as part of the same equation. So Cabinet Alcavina for many years has been developing tools to support partner organizations in gaining resilience when it comes to managing their personal well-being, their personal networks, and safety and security considerations, not only on an operational level, but also on an individual level. Thank you. I think that my presentation is over. And
thank you very much, Jana. That's really, really interesting. I'm going to take the liberty as the facilitator of asking a question. Could you just say a bit about what do you think the role of the organization is particularly in domestic violence? Because this is a question that comes up and a discussion that comes up quite regularly. I mean, apart from COVID-19, and we know that COVID-19 has I mean, all the statistics and evidence have shown that it's very much exacerbated domestic violence. But, you know, in the past, it's been considered something that happens in the sort of private sphere outside of work. So, you know, from your organization's point of view, it would be really interesting to hear what the role of the organization is felt to be in the issue of domestic violence.
Absolutely. So we think that it's not because domestic violence happens outside the working environment that we should disregard it as an important incident. So domestic violence has different lenses. The first lens is the well-being of staff, and that's why, for instance, when we think about well-being of staff, we think about we only know if staff is being well supported if we know that the sexual harassment existed. That's why we have an incident report system where we considered abuse and sexual harassment and abuse as part of domestic violence. And if that happens, we have mechanisms where staff can report it in a confidential manner, and all support, either psychosocial or even in terms of orientations or where to go for medical support or even legal support, can be addressed. So that's the first point, is that we have these confidentiality mechanisms. The second point is to make sure that the legal framework of the country where the sexual abuse or harassment was conducted is supportive or not of legal action. And that also has to do with the stigmatization of women in this part of the world when it comes to sexual abuse and harassment inside the marriage or the family units. And sometimes it's not perceived as harassment. So from our side, there's a lot of awareness when it comes to that, where we explain that sexual harassment and abuse can be conducted in the workplace, in a house or in a family unit, and on the street. So there's a continuous awareness for that for that subject with staff. Also, we consider that the last decision on how to proceed with the sexual harassment charges comes from the survivor. So in that case, we do not pressure staff to present a legal complaint, but what we do is that we give the staff the confidence to know that if they presented a legal complaint, we will be supporting staff during that process. And that support starts with the psychosocial support, for example. And the third point that I want to highlight is the importance that to have clear procedures in terms of where to get a PEP kit and how PEP kits are administered on the country on the country office level. Different countries, they have different legislations, they have different references on where to go for a PEP kit examination or who administers those PEP kits. So having those talks in terms of understanding the legal framework, understanding that PEP kit can be administered for only for personal security, but can also be for pursuing of legal action, and how can we combine the two, or how can we support in administering the PEP kit in separate ways in case the survivor doesn't want to pursue the legal avenue. It's very important.
Thank you. That's a very thorough answer. And I know that, I mean, some of these issues were touched on by Elizabeth and Namisha in the module on gender and COVID, and I know PEP kits were mentioned. Elizabeth or Namisha, do you have anything to add to that answer that Johanna gave us in terms of the work that you did and the research that you did with different organizations in terms of the organizational perspective on domestic violence and why it is an issue that security risk managers need to be involved in and aware of?
Yeah, absolutely. There's a lot of different ways that you can look at it. One of them is that anything that happens at home also affects a person and their ability to work. So having extra support when people are going through distressing situations, and if they aren't able to help with every facet of them being harassed at home, at least providing mental health and physical health support was extremely important to survivors.
Great, thank you. Elizabeth, anything to add?
No, I think it's Joanna and Namisha really addressed it pretty comprehensively, and it's for me it was surprising to see how many organizations were taking this on as a security risk, because when I was working as a practitioner, I think up to 10 years ago, this wasn't really talked about. So again, it was part of the really rewarding process that we had of being able to talk to these practitioners and realizing that now it really is a security issue and is being taken seriously by a number of organizations.
Great. We're very much open now to questions from participants. If you'd like to pop any questions that you do have in the Q&A. We have a few that have had come in already, so I'll just sort of lead off with some of those. But please do, anyone that's participating, do put questions that you have for the panel in the Q&A function. So a sort of a general one to all three, if we can highlight Johanna as well in the panel. What would your advice be for security managers working to sort of elevate the inclusive practices within their organization? I mean, we talked about some of the issues, but I think particularly, we've talked about very much about how COVID has magnified lots of pre-existing inequalities and issues within organizations. So it's not that they didn't exist before, but COVID has definitely made a number of things worse. So yeah, what would your advice be for sort of security managers? I think most of the participants on the call are security managers. So what can they do to sort of elevate inclusive practices, within their organizations? Elizabeth first, maybe.
So no, I think one piece of advice I would give is first of all, people may see, and this is an assumption that I'm making. I haven't talked to anyone who feels this way, but I know that similar dynamics have emerged around sort of new trendy topics, things that are seen to be not core to what we do as security managers. Humanitarian access, for example, sometimes is looked at as being sort of a nice to have, or a distraction, or a donor imposed initiative. And I would hope that diversity, equity, inclusion, or DEI practices within your organization or initiatives within your organization are not seen this way, and actually are not this way. So I hope that they are organic, and I hope that they are being sort of given the space and the support that they need to have within the organization, and that they're rooted and really grounded in practical considerations. But I suspect that that's not always the case. What I would say for security managers, again, is to say, well, you do have influence over this issue. You oftentimes are sitting on the SMT, or are close to those people who are decision makers. And it's important that we use our power and our privilege to push this agenda forward in the way that is practical for us and our considerations around security risk management, but then also just basically seeing that we have a stake in this as well, and that it is not just an initiative that's coming out of left field. It's really core to what we do. So I would just say, consider yourself a part of it. Look and see how it is core to what you're doing. Look and see how it leverages what you're already trying to do. And just see where you can use your power and your influence to push those things forward.
Thank you. Johanna?
I actually do not have much to add on to Elizabeth, but I think that one input that I could give is to continue having these conversations, not only with your senior management team, but also on the country office level, and try to understand how perceptions are on inclusivity in gender, because they are not always the same, depending on if you are on the field or in a head office, and try to harmonize these views and confine a message that can be accessible to your organization, either on the field or on the country office, on a head office level.
Thank you. Namisha, do you have anything to add? Oh, you're on mute.
Thank you. No, I think Elizabeth and Joanna said it perfectly. The only thing I would add is just making sure to have open dialogue. Often when people aren't in a position of power, they might be uncomfortable bringing up any special accommodations that they might need. So it's important for security risk managers to be the first one to ask that question and bring that up, so that people feel comfortable coming forth.
Thank you. And another question that we've had is that obviously, because of COVID-19, there've been a lot of flexibility needed, a lot of adaptations to programs, some cost savings potentially in terms of staff not being able to travel and so on, but a lot of additional costs that have come up, really practical things around PPE and having to have more vehicles to improve the ability to socially distance and to do field work and lots of really practical things. And one of the GISF modules is on cost implications and donor requirements, and we've not had time today to go over that one. That could be a whole other session. But in terms of some of the things that we have discussed today, particularly around inclusivity, around gender-based harassment, where some of the things we've mentioned, perhaps things like training, additional staff members, or those kinds of things, putting into place different practices and measures. Those things do have cost implications potentially, not all, some are just general, but I guess the question sort of boils down to that's on top of these already lots of other costs, is how can organizations, particularly those with less resources, how can they sort of still provide adequate support for staff on some of these key issues?
I'm assuming that it might be going to me.
Yeah,
yeah, so I want to flip the question around on its head a little bit, just because, and this may be kind of an easy out, but the way that I see it is that consultation and really ensuring that your decisions and your decisions about resource allocation are grounded in reality is key to reducing cost, right? Is key to reducing extraneous cost. I mean, perhaps one example I might use would be if you have a limited amount of resources and you're trying to mitigate risk in an entire country operation. If you're only talking to the people who are living in the capital, or maybe you're only investing in the opinions of those people who you happen to be sharing housing with, or happen to be going out with on a Friday night, or sitting in the SMT with, and they only are from a certain group, but you're neglecting the opinions, or you're not investing the same amount of value in the opinions of people who happen to be working in different field locations. If those field locations happen to be experiencing more risk, if those individuals experience more risk, then you're not actually doing justice to your resource allocation. What you're doing is you're allowing your own biases and your privileges to shape incorrectly how you should be distributing those resources. So in order to really, in order to make good resource allocation decisions, you really have to be inclusive. That's how I would frame the question. Yeah.
Yeah, I know you've probably had practical experience of this, having to make difficult decisions about how to allocate resources for lots of very, very pertinent issues, and how to sort of decide amongst them, and when you have a limited budget.
Yes, so different countries, they have different priorities of risk. So what we do is that normally we promote a dialogue and sharing experiences in between country offices in terms of how do we allocate resources, and we try to engage program managers as much as possible. And for instance, if a very practical example has to do with some types of trainings that are more relevant for high or extreme risk locations, like contingency planning and COVID-19 practical measures on how to reach out to beneficiaries during COVID times. What we do is that when one country office has one of these requests, we try to engage other country offices so we can have a training that it's useful for different offices, and we do not have to replicate one training at a time or a country office at a time.
Thank you. Nimisha? You're on mute again.
Sorry, I keep forgetting to take off the mute. No, I have nothing else to add.
Okay, I'm sure there's lots of experience of that in the amongst the participants, of having to make sort of limited budgets go a long way, and having to compete with different sort of agendas and different priorities within your organization on trying to get your funding for initiatives that you're working on, and so on. I guess it does lead to one other question, which is that the inequality of COVID that's been highlighted through the various discussions. It has highlighted many issues. Do you feel that this could be actually a kind of a moment or an opportunity for organizations where they could bolster some of the things that were maybe before were sort of a bit bubbling under, but now COVID has actually brought more things to the surface, if you like? It's a difficult question, because we don't want to see COVID, it's had terrible consequences for many people around the world. So we're not saying it's a great opportunity, but as in my experience in working in an organization where sometimes perhaps a serious security incident actually could be used within the organization to push forward sort of security risk management agendas and so on. Do you think that's the same with COVID, that this could be a moment we could actually move some of the thinking and agendas forward? Perhaps we'll go to Namisha first this time. Keep coming to
absolutely. I think that anytime something devastating happens, especially like COVID, there are so many lessons that we need to take out of it. One of the one that was highlighted in the literature was mental health, because that's something that's often been overlooked and a lot of resources haven't been put to it. But now, after people having to have work from home, facing situations of harassment and violence and being isolated from resources they previously had, we've seen that in a post-COVID world, or the new normal, we really need to invest more into mental health support. And it doesn't have to be an expensive resource, because there are a lot of resources online now, but that definitely has to be a focus.
Mm.
I totally agree. I have a comment. I don't know if you remember before COVID-19 that we would talk about the PTSD in humanitarian world as it was a normal thing. And of course that the organizations would always provide us with mental health and psychosocial support in case of PTSD, but it was something that it was spoken about it, but it was kind of natural, and it was sometimes perceived as a rite of passage in humanitarian worlds. And suddenly COVID hit, and we have entire organizational structures that are suffering from anxiety and stress because of confinement and lack of interaction with colleagues, and also inability to reach out to the beneficiaries. So I think that definitely there's a new outlook on well-being and mental health after COVID, and this needs to be fostered. So organizations should have a more lens look at it from a needs perspective, staff needs perspective.
Thank you. Elizabeth?
Yeah, so the first thing that comes to mind is just investing in technology and investing in IT is really one of those costs that really can do a lot of good if you have the time and the resources to invest in that. Although it's also one of those costs that falls by the wayside when you are really dependent on short-term project-based funds. So it's again, as COVID's come up, everything's going online. This is something that we obviously now need to invest in, and it's come to our attention. The other thing that I just want to mention is that I think the COVID has also culminated with the fallout from the death of the murder of George Floyd in May last year, and we've seen an outpouring of voices that have come out of that in terms of just relating issues of discrimination, issues of racism, issues of inequality and inequity, and it's come out in every sector, including ours. And now that we have more prominent voices that are coming to the fore, that are from diaspora-led organizations or former national staff or current national staff, or people who are from the global South, if I can use that term. It's really important that we just harness that and pay attention to it, because these voices have always been there, but they haven't been paid attention to. So I think the more that we can take that information and go with it and build from that, the better.
Brilliant, thank you. We have a question in the chat, which I'll put to Johanna first, I guess, potentially as you raise the issue. So just what are some of the considerations or challenges that faith-based organizations might face with PEP kits, or perhaps in countries that are less secular?
Okay, so I can't talk about this topic in general, because my scope is reduced to the Middle East and North Africa. What I can say is that unfortunately, most of legal settings in the Middle East, they are still very restrictive in when it comes to PEP kits availability. I'll give you an example. For example, in Jordan, only one hospital in Amman is able to administer a PEP kit. And I don't think that in the case of Iraq, for example, that PEP kits are available even. So there's referenced doctors that can administer PEP kits. So that shows you a little bit how complicated this issue is, specifically for faith-based organizations. I think that you need to have in consideration, local legal requirements and frameworks for PEP kits, but at the same time to ask the question to the staff directly. And I think that PEP kits, they are not only efficient as in providing the pill of the after day, but they are also essential to avoid the survivor to get some STDs such as AIDS. So I think that you need to think in a broader lens or a broader scope in terms of the safety of your staff, and try to make it as available as possible in a location where you are. Thank you.
Any comments from Elizabeth or Namisha on that one? No, it's a very comprehensive answer. Thank you. I guess I think we probably have time for a final question, which just sort of linking back a bit to the vaccine survey, vaccine benchmarking survey, which we discussed at the beginning. I mean, in that survey, one of the things that came out that was very clear was that the decisions that are being made about COVID policies and the sort of higher level things about the organizational policies. Will organizations have vaccines? Will they require staff to take them? Will it be mandatory, and so on? That it came out quite clearly that the CEO is making those decisions, and in some cases there were a sprinkling of other parts of the organization that would be involved in that. But I guess my question to you all is, who do you think should be involved in making those decisions? Perhaps if we go to Elizabeth first and then move around
So this is something that maybe is a bit out of my remit. This is not a question that I asked people who I had interviewed for either of the papers, although it did touch on it with some of the interviews. And I would just turn it around to the audience to see who is involved in their organization in making those decisions, and or who they think should be involved. But I don't have an authoritative answer for that question.
I guess from your personal experience, what do you think? I mean, of course, the CEO is always going to have to, on big global corporate decisions, is going to kind of have to sign off.
Yeah,
we accept that, but it's like, who do we think, given this discussion we've had about all these different issues, who do we think we should be trying to involve in an organization in sort of coming to a decision, or briefing the CEO on the decision, if you like, on what decision they should be taking?
Sure. I mean, I think most of the people on this call are working for organizations that have at least representation in a number of country offices, if not a few, if not a lot. So I think with that amount of information that needs to be digested, it needs to be looked after by a team of people at the headquarters, and receiving information up from each of the country offices, and sort of synthesizing that information before you make a decision. I think we're all used to that now, a year and a half into the crisis of making decisions that affect large swaths of the globe, with a lot of information, and having to synthesize that information at the headquarters level. So I hope that that's being done in a similar way to other decisions that are being made.
Namisha?
Well, I think the staff definitely should have a say. And when things move up to the CEO, just understanding that for people who choose not to be vaccinated, that post-COVID work, it's still inclusive as possible to accommodate their decisions.
Johanna?
Yes, I agree. We can't put barriers on vaccination or imposing vaccination on staff, because at the end of the day, it's a personal decision, but we can advise on what are best practices and what science tells us is the best way to go, and be inclusive at the same time. So without discriminating those who think that they would be better without any type of vaccination, for example. Yes, but for sure that these conversations, they have been happening. These conversations, they happen on the country office level. Sometimes staff take the initiative to, for instance, being vaccinated without managers knowing, and they find out at the end, and that's great. But I think that at the end of the day, it's based on conversations that come from country office up to the head office, and try to accommodate what are needs, best practices, and scientific learning.
That's a very good point to end on. Thank you. I think that brings to a close our webinar today. I don't think there are any outstanding questions. So that just leaves me to thank the all three panelists. Thank you very much, not only for the work that you've done in terms of the modules, but also for joining us today to talk about them in such sort of detail. For everybody, we've just launched a poll, so if you could do that before you nip off, that would be great. And just to remind you that that all of the modules are available on the website. I think they've been put in the chat as well, but they're available on the website. And a final reminder that obviously we have a series of webinars that we've planned over the next period, but we're also, as of this week, involved in the HPNW Weeks, which is the Humanitarian Partnership Networks Week, run by OCHA. Weeks, actually, it's normally a week, but it's now 3 weeks as it's online. And that GISF is leading the priority topic of security risk management. And there's a number of webinars over the next 3 weeks. Each webinar is repeated twice, so you can join at different times and things. And we have some of the topics are security risk management in the changing global humanitarian context, sharing risk, building stronger partnerships, acceptance and access, managing security risks in the digital world, and a person-centered approach to SRM in humanitarian response. So some of the issues that we've touched on today in different ways. So on that note, I'll just say thank you very much to everybody who joined us today, and thank you very much to the speakers.